Today I would like to start with an activity. Close your eyes and imagine you're a doctor in the 1980s and you're about to perform an induced abortion. You feel comfortable because you have been doing this for so long, but this performance is different because you have the innovation of technology of ultrasound. You're ready to proceed into the woman's uterus to kill the baby, but the ultrasound shows you how the baby's mouth is open in a silent scream when the surgical instrument gets near. No matter what the circumstances are, it is a right to do it. In the United States, about 22% of all pregnancies end in an abortion. Now open your eyes. After my visualization, I will emphasize the following statistics and then I will announce my 3 main points. The worldwide rate of abortion this year is 50 million. There are over 3,000 abortions per day in the United States. 35 induced abortions per 1,000 women are aged between 15 and 44 years, and the rate of abortions is higher in developing regions. Today I will be talking about abortion and why people should stop using it as an option. By the end of my speech, you will have learned vital facts that will allow you to be able to take important and crucial actions that might save the lives of millions of babies. My points are what is an abortion, reasons why women use this procedure, and the methods and baby's reaction. Now that I have said my 3 main points, I would like to address the first one. What is an abortion? This society have formed 2 different organizations that have different beliefs. They are pro-choice and pro-life. Pro-choice are the people that want to legalize abortion, and pro-life are the ones who are opposed to this idea. But what is an abortion? It's the deliberate termination of a human pregnancy, most often during the first 28 weeks. The organization pro-choice usually use this myth to defend their points, but they are wrong. The first one is, a fetus is not a human person. According to the Dr. Michelin Matthews and Dr. Alfred von Giovanni, says that an individual human life begins at conception. My body, my choice. The baby is not a part of your stomach. It's a real growing person inside a mother's womb. It is a woman's right. Unborn child has the right to life. No one can take that away. There is no natural right more basic and precious than the right to life. So, how could the denial of this engender so-called woman's right? And the last one is needed in case of rape. Society needs to stop telling people that they cannot bring rape's baby to the world, because everyone has the right of equality. Now that I have told you what is an abortion, I will tell you the percent of reasons why women do it. According to a survey from 9 different abortion clinics across the country, established that these are the reasons why women do abortion. 1% were raped, 23% are the ones that cannot afford a child, 25% are the ones that are not ready to have a family, 8% are the ones who don't want to be single moms, and the last one is 4%, and those are the women who think the child is going to interfere with their education or career. All these women have a specific reason to commit such an action, but why not search for other options? A lot of women around the world are willing to be mothers, so why not look for a family who really wants to raise a baby instead of get rid of them? Now that I have told you the reasons why women use this procedure, I will tell you about the methods and reactions of the baby. Baby can feel pain by the 20th week. So the first method is suction aspiration. This procedure is done by the first trimester, 5 to 13 weeks. The baby has fingers, heartbeat, toes, arms, and legs. But its bones are still weak and fragile, so the doctor uses aspiration to remove uterine contents through the cervix. The second one is dilatation and curettage. It's a surgical procedure involving dilatation of the cervix with seaweed and curettage of the uterus. This one is done in the second trimester to 12 to 24 weeks. The baby actually can feel pain during this procedure. And the last one is injection and stillbirth. This occurs in the 3rd trimester, so 25 weeks to the term. The baby is fully developed, so actually the baby can survive outside the womb. The doctors inject a big amount of hard medicine into the head or chest of the baby to kill it inside of the womb. And after 2 to 3 days, the baby is extracted of the womb using the curettage.
After hearing about this polemic topic,
I would like to ask you some questions. How many of you that are pro-life are willing to preach about the wrongness of this option? And how many of you that are pro-choice will consider change to pro-life? Thank you.